Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Holly Phillips. First up, last week, Jon spoke at a global health conference in Houston, warning about the growing threat of the Zika virus in the U.S. He also checked in with the troops on the front line of the battle.
A team of mosquito hunters has set traps throughout Houston neighborhoods. They take them back to a lab where they freeze the insects, sort them, and grind them up for testing, looking for viruses like West Nile, dengue,
and if you guys would follow me in here, I'll show you.
And now, Zika. So far, there's no evidence mosquitoes in the United States are infected with Zika virus, but scientists say it's almost inevitable. The recent flooding in Houston means an explosion of potential breeding sites.
It just rained a couple of hours ago, and I can see there are some puddles of water inside the tires there.
John, this is 80s Egypti heaven right here.
Infectious diseases expert Dr. Peter Hotez says protecting vulnerable neighborhoods is critical for disease prevention.
For Aedes aegypti, they're so intimately linked with human habitats that they've evolved to breed in tires and in plastic containers, and those are what have to be removed.
So the 3 Ds are to drain, dress, and DEET.
Dr. David Peirce directs the City of Houston's Disease Prevention Services.
The one misconception that I'm hearing is that it's not really, it's not going to be a problem. But certainly for the families of the children who are born with microcephaly, it's going to be devastating.
John, what did the experts at this conference say needs to be done to fight Zika?
They just want to get ahead of it. They don't want to have to wait till the mosquitoes are here in large force, and that the first case of a Zika in a mosquito in the United States occurs, at which point there's going to be a lot of concern, if not panic, in some people. And there are things that they can do now. They can go into these neighborhoods like you saw. They can help clean them up. They need more inspectors. They need more mosquito traps. They need more virologists. They need more labs. We were in a closet, like a storage closet, that they want to convert into a laboratory to test for the Zika virus. And basically, the bottom line is they're saying, do we really have to wait until the mosquitoes are here in full force before taking as much action as possible?
Well, moving on this morning, recent reports have hinted at some progress in the battle against childhood obesity. But a new study finds that may not be the case. A flip-flop, sort of a flip-flop.
Yeah, there had been some small, encouraging studies showing that in specific populations, in specific cities, the youngest kids, we were seeing a leveling off of childhood obesity. But this data comes from one of the largest studies that we have involving health and nutrition in kids. And it showed that it really, for the general population of kids between the ages of 2 and 19, childhood obesity has continued to rise steadily between 1999 and 2014. And significantly, they found that class 3 obesity, which is the most severe form, also increased significantly during that period of time.
John, we know this is very complex, but what are some of the factors that contribute to childhood obesity?
I think it's helpful to go back and realize that we're fighting evolution. So in evolution, 1 million years ago, there wasn't a lot of food, and we're built to, if there's any extra calorie, hold on to it. Store it in that belly fat. Well, back then, there was no obesity problem. There weren't that many calories around. Now, there's plenty of calories. So any calories that we have, anything extra, goes right to the belly fat, and then it stays there. It's hard to get it off. So we have to sound the alarm, as is being done, but it's an entire village has to gather around this. So we have to address this from industry. So stop selling us junk food. Sell us more healthy stuff. There has to be more activity. People are just hanging around looking at their screens. They've got when I was a kid, when you were kids, right? You went out and you ran around, you played. They don't do that as much. You have to be able to educate people to what's going on, and you have to be able to have in schools healthier lunches. You have to have, for people who can't afford healthy food because it's more expensive, you have to lower that price. So it's every different angle of it. And the bottom line is you have to create a village where it's just healthy, where you trip over healthy behavior, the food is healthy, there's a lot of activity, there's walking paths, and that's the way to get around it. No one
It's so interesting, too, because it's become such a part of the national dialogue, especially with the president and the first lady saying this has to be a central concern.
I agree with you, Vanita, and just to pick up on what John said, it really, I think what is so striking about this data is that childhood obesity is not an issue that's been completely ignored. So during this period, 1999 to 2014, there's been a great increase in public awareness, both of the risks of childhood obesity and of the epidemic itself. And so I completely agree with you, John. This has to be, more of a global approach, right? There are children, for instance, who luckily, most children have some access to health care where, for instance, they can go into the doctor, they can be diagnosed with type 2 diabetes, which is a complication of obesity, and they can be treated for that diabetes and followed for it and given medication. Those same kids may not be able to have access to the Y, to get activity. Their phys ed programs may have been canceled in school. They might not have after-school sports. So, I think it's a dramatic reallocation of resources that we have to look at.
Well, finally this morning, if you were having trouble remembering something, start drawing. That's according to researchers at the University of Waterloo in Canada. They found that when it comes to remembering a list of objects, drawing pictures was more effective than writing words repeatedly or adding visual details to letters. And for those self-conscious about their artistic abilities, fear not. The researchers say the trick works regardless of your talent level.
It is so fascinating, right? So memory is so complicated. It's stored in many different areas of the brain, and it's involved with smells and tactile and sounds and visual things. And my entire life that I can remember, when you're trying to think of something, you're trying to remember something, and you go, hold on a second. What are you doing?
Yeah.
What are you doing? We still don't know.
I'm going to draw where I put my keys.
Oh, right.
Yeah.
That's where they are.
I need to get some oil paints out to take care of my
What's
mommy
going
brain.
on there?
All right, Doctors Jon LaPook and Holly Phillips, thank you both very much.